This is Lucy Dominguez with IMO. Thank you all for joining our call today. And I would like to start off by introducing DC Campbell, who's going to kick us off. Thank you, DC. Go right ahead. You have to take yourself off mute, DC, then we'll hear you.
Lucy, can you hear me?
Yes, very good. DC, would you like to kick us off? We've got quite a few people on the line and we're ready to get started.
Yes, and Dr. Halston is also going to be joining us in a couple of minutes. Because of heavy Wi-Fi and internet traffic today, he might be a little delayed in making the connections, but he's going to be on real soon. I just want to start by saying thank you all for joining us. I know that today is a critical time in terms of how we take care of our employees, how we take care of our families, how we take care of ourselves. I hope you're all doing well and riding the storm. And we know, like with every storm, this too shall pass. Today, the topic is timely in that we're talking about telemedicine in the age of the coronavirus. We want to make sure that you feel confident that IMO is ready to take on that task, and we want to let all our clients know that we are indeed right now taking care of all employees as well as to keep them in connection and totally connected with what we're doing to protect and to help your employees as well. We're essentially 100% remote. We've done this, we've been practicing and training and testing for this since 2016. So we're pretty much 100% remote with our staff today. Whether an injury occurs in Houston or Dallas or San Antonio or anywhere else that we have coverage, we have our staff engaged with the system and with our medical staff to continue to provide those services. As often as we hear the word coronavirus today, we hear telemedicine, and we know it's a powerful tool in helping to restrict the spread of coronavirus. Dr. Halston is, of course, exceptionally qualified to do this presentation for us today. He's the medical director of the ReadyMD organization, the medical organization that's in partnership with IMO. And so he will be with us shortly. I should point to you that IMO began our Telemed program with ReadyMD in December 1st, and the announcement pretty much focused in on some of the benefits, some of the costs, and some of the other benefits in terms of returning injured employees to work in a timely fashion, taking care of their injuries without having them proceed to clinics if it's not necessary, if it's a non-emergency injury. The announcement accompanied a sentence, I think, that pretty much forecasted what we're looking at today. It said that telemedicine also has an unexpected benefit. It is ideal for injured employees who are reluctant to visit clinics, especially during seasons when their chances of contracting viral infections increase from exposure to other patients. This was a concern before the coronavirus, and now it's even more profound because we believe with this virus, the telemedicine can indeed allow injured employees to receive non-emergency services quickly without exposing them to additional virus risks that we have in the community today. So what we have today is going to be a presentation. We want to answer your questions. We want to calm your fears. We want to let you know that your injured employees will be taken care of, whether you're on a subscriber or non-subscriber. It matters not to the Telemed program. The technology, the advantages and benefits are the same. Telemedicine can handle up to 80% of non-emergency injuries that occur in the workplace. And with early intervention, faster recovery, and reduced medical costs. An added benefit today is that they can keep an injured employee from compounding their situation by contracting the virus. We know that some injured employees would be hesitant, particularly today, to go to a crowded clinic. We hope that today's presentation will help reverse some of those fears and show that the telemedicine option is a very valid and very timely one as well. We will cover as much as we can in the first 30 minutes, and we'll leave some time available for you. If you have questions, you can certainly enter those on the side of the screen. We also have an email address at the bottom of the opening slide that you can send us follow-up questions or any concerns that you might have. And we'll try and get back to you just as soon as possible with any of those emails. But today, we have the authority to talk to you about it. Dr. Halston is the medical director of ReadyMD, IMO's Telemed partner. He's majored in biochemistry and pre-med at the University of Texas in Austin and graduated with honors in 1996. He then did his medical training at the University of Texas Medical Branch of Galveston. He's board certified in family practice with concentration in occupational medicine and is certified to do impairment ratings as well. He's been practicing family and occupational medicine since 2004, and he has 20 years of experience in telemedicine, conducting more than 20,000 telemedicine visits since joining ReadyMD in 2008. Dr. Halston, if you're on, this is a good time for you to jump in and take over. It's all yours.
Yes, I'm on, and good morning, everyone. I wish it was better circumstances. I mean, we have an outbreak now that's really hasn't happened since roughly, 2000. The early 1900s. Now, what I always like to talk about is kind of some background on this virus, so you can understand. There's a lot of questions: why there's not a treatment, why there's not a vaccine, why is it taking so long to get a vaccine. So I just kind of wanted to give you some of my background, some biochemistry of the virus. So I don't want to bore you, but I want to give you some background information. Basically, there's two types of viruses. There's a DNA virus and an RNA virus. Classic DNA viruses are like the flu. So what happens with the DNA virus, when they replicate, they essentially make exact copies of each other. So you can actually get a vaccine pretty quickly. That's why flu is a typical DNA virus. You can get a vaccine that works very quickly, and it pretty knocks out the flu. As long as they have the right strand, you can knock it out pretty quickly. Now, the COVID-19 is an example of an RNA virus. An RNA virus is kind of sloppy when they replicate. So they don't have an enzyme that guarantees it's the same copy each time. So when they replicate, they don't replicate exactly the same. So the virus is constantly changing slightly, which makes it very difficult to have a medication that will counteract it or a vaccine that will counteract it. So you really can't, you have to look at ways that it doesn't change, and that actually takes months or even years. And they're saying right now with COVID-19, they're in testing, but a vaccine will not be out probably for up to a year on that. So that's some background on it. And then some recent data on it. As you know, it's rapidly spreading through the United States. It's from one individual in China. They think it's from bats. An RNA virus mutated from basically a virus in a bat to a human, and from there has been rapidly expanding. In Texas, there's roughly 600 to 700 cases, and maybe even thousands now. There actually has been reported in the last few days a couple of deaths now in Texas from this virus. It's a good thing and a little bit of a scary thing. They say for each person that gets tested and has the symptoms, there may be at least 5 to 6 that actually have the virus and can transmit it that do not have any symptoms. So the good thing is roughly 80% of the people that catch this virus really going to have very mild symptoms, coughs, colds, maybe mild flu-like symptoms. Then 20% get into the more severe flu, more severe pneumonia symptoms. And from there, a percentage of them can end up in the ICU. So and who, you know, what it just kind of also depends on how the virus attacks. If it just attacks the upper airway, then you're going to have those mild symptoms. If it actually gets in the lower airway, then you have those more severe symptoms like pneumonia and the above. And again, most of the viruses, when you look in the United States, the people that are having trouble with the virus are the older, you know, chronic disease, diabetics that are not controlled. So in this time, it's very important for people to control their diabetes, control their asthma, make sure the congestive heart failure is controlled, because as you know, especially in Houston here where I am, they're shutting down restaurants and bars to contain this virus, and hopefully we'll contain it. But again, it's so contagious that they're doing everything they can. Hopefully they slow the rapid spread of this. And so one of the things that we've given IMO is kind of the coronavirus evaluation form and what to do when you have an employee at work that has this or suspected of this. It's a protocol sheet. You know, pretty much now the CDC guidelines, since there's not a vaccine, there's not any direct treatment, only supportive care, is really employees that get COVID-19 need to actually stay at home. That's the biggest thing the CDC is saying over and over and over is stay at home, stay isolated. And you know, if with your family member, you isolate a certain bedroom and actually kind of limit contact with the person possibly infected. And that's really where telemedicine really comes in and really helps out, because a lot of people don't know the symptoms of COVID-19. They're concerned, do I have it? Do I not have it? So that's where telemedicine really works well with the CDC guidelines. Patients stay home. They don't go to the emergency rooms. They do not go to the doctor's office and risk infecting other people, especially when they have mild symptoms. We at ReadyMD can actually log in, actually see them at home, make a determination, is this COVID-19, or is this sinus infection, or is this you know, allergies, or is this the flu that can actually be treated? And it's very important to actually treat the flu with Tamiflu, which can be done. Also, we can actually screen the individuals and make a determination if they do need to be tested. Now, the testing, they're not going to let everyone get tested. So basically, the testing criteria right now are basically right now they're requiring a prescription or an order from a doctor to actually get tested, since there's limited tests. And the testing criteria are going to be, you know, more sort of if you're older, chronic disease with high fever, or if you've got a lot of respiratory symptoms, then you need to go get tested and make sure, see exactly what you have and make sure it's not the flu. Some other background information. I kind of want to go through background information, and then what I love is to answer any questions you guys might have. So the typical symptoms are, you know, running fever. They're essentially exactly flu-like. Running fevers, achiness, chills, and the big thing is a dry cough. I mean, if you're coughing up green stuff, wet cough, sinus pressure, those are classic signs of another type of infection. So the dry cough really should be, especially this time, the flu is actually ending, so any high fever should immediately be suspected of COVID-19, and patients need to be isolated at home and kept at home and actually be seen by a physician through telemedicine as the new CDC guidelines. Some of the other really important thing is when you actually suspect somebody that has COVID-19, you know, you isolate them at home, but they've been, you know, at work or around the house, what to do. So you need to actually disinfect the areas. And the newest guidelines on this from the CDC, any hand sanitizer, if you can find some, needs to have at least 60% alcohol, better up to 70% alcohol in the hand sanitizer. Now, to clean up, you know, doorknobs, anything that the sick individual's been touching, the best actually right now is using Clorox bleach. And you can actually make your own home sanitizing solution. What's recommended by the CDC now is 4 teaspoons of bleach per quart of water. And actually can make your own home sanitizing. Anything the individual has touched needs to be clean. You know, COVID-19, it's transferred mostly through respiratory, meaning cough, sneezing, respiratory droplets. They can you can get into your mouth, nose, or actually through the eyes. So it's very important to disinfect all areas the individual's been around. Also, there are some studies right now, no one knows for sure, but COVID-19 can definitely be on counters for at least a day or two, or 24 to 48 hours. The thought is, so if an infected individual coughs and touches a counter, later on, 24 hours later, somebody else touches that counter, it is possible to get transmitted that way. So it's very, very important to disinfect areas on that. And then, and currently right now, we've been looking up and following this through ReadyMD. There's approximately 56 testing sites in Houston. In the greater Houston area, there should be up to 300 by Thursday. And we're actually looking throughout Texas. We should have some more testing sites, and all of them are actually requiring some sort of order from a doctor. They just don't want to get overwhelmed with everyone to be tested, which kind of makes sense right now. And the sicker, the older patients are the ones that really need to be tested to make sure that it's not the flu or some other treatable illness that can be treated on that. So I've got some, you know, kind of true-false questions we can go through, but that's generally kind of, I wanted to go through briefly through COVID-19, and I'd like to answer questions if you guys have questions.
Dr. Halston, this is VC. I've had a question the last couple of days. I know that we have a text number that we just posted on there that folks can use to text questions. It's 972-342-2141. In case you don't see that slide, 972-342-2141. You can text your question. But I also had a question that has been posed to us in the last couple of days, that we've probably seen a reluctance in current injured employees not wanting to go to a doctor's office or to a crowded clinic because of the valid concerns that they have. Now, using, say, one of our most common injuries, low back soft tissue, what are some of the risks if an injured employee has a low back soft tissue injury today and decides to hold off for a week or two to seek non-emergency care because of that fear? What are some of the risks that they face if they wait that long for that treatment or that consultation with a doctor versus an injured employee who today utilizes telemedicine and calls a doctor to not only about the coronavirus, but certainly to talk about the injury that they just had today, but they're expressing reluctance to see a doctor. What are some of the medical ramifications of delay, say 2 weeks versus the same day consultation, if that makes sense to you?
Great question. You know, the patients need to be evaluated because there are some back injuries that are more severe. Certain kind of numbness in the legs can be a more severe injury that can get much worse, and there can be some neurological permanent damage if they're not triaged. But essentially, with most back strain, they're going to get worse and worse and worse. You know, and they're smart not to go to clinics right now. The clinics are going to be, as we actually, you know, we did a presentation 6 months ago and talked about going during flu season. Well, this is, you know, COVID-19 obviously is much worse. So being treated at home by telemedicine, getting on the proper medications, stretching exercises, because within 2 weeks they can be much, much worse, and it's a much harder injury to treat. Very good question. So they do still need to be treated. Telemedicine works perfect for them to get treated appropriately and on the right medications and the right stretch and exercises. And actually, most studies have shown, you know, with the right medication and stretch and exercise, they can heal at home for the workers' comp injury and necessarily don't even need to be seen in the clinic. Great question.
Okay, here's a question. Dr. Halston, can you hear me?
Yes, ma'am, Catherine, yes.
Okay, here's the question. This is Catherine. I'm calling from the office. It's a texted question. If you only have an annoying tickle, dry cough, off and on during the day or night, no other symptoms, is that nothing?
It's not nothing, but that's not COVID-19. Now, COVID-19 usually runs fever. Now, one of the things about COVID-19, you're actually contagious the first 3 days before you run fever. But when actually the virus is really rammed up, you're always going to have fever with COVID-19. So a tickle in the mouth, that's most likely, a viral infection, a cough and cold, and that wouldn't be COVID-19 unless it's the very, very early stages of it.
Okay, here's a question. If we're working in a warehouse and we're in, say, 20,000 square feet, and the employees are working within the scope of, say, I don't know, maybe 100 square feet from each other or 20 square feet from each other, is that applicable or reasonable to say that you can still have people come into the office, into the warehouse, if no one is tested, or say someone is tested and they have the symptoms, but they're tested negative, but they've been around somebody, you would suggest quarantining that employee. Is that correct? What's the square footage? Do you know of any that might be out there as kind of a standard for people to recognize?
Yes, 6 feet is kind of the CDC standard. It's not a guarantee, but generally, it's respiratory droplets that you catch the virus from. So generally at 6 feet or further, you're probably okay. Now, one of the screening criteria, we have a screening that we've given IMO that all patients that are sick need to stay at home with any kind of fever. So that should immediately get those employees that are sick to stay home and be evaluated. So if you're not running fever and you're staying 6 feet away, and anyone that actually, if somebody does come with the fever with COVID-19, you really need to isolate them, keep them away from everything, and send them home and actually clean up the space with the disinfectants we talked about. But 6 feet is the kind of the ideal distance.
Here's a question. How important is it to stay hydrated?
With all infections, hydration is very important. Allow the kidneys to function. Any kind of infection, what you do is you basically, your body, your immune system fights off the infection, and then you kind of, you get rid of it, you expel it through your urine. So it's very important to stay dehydrated for sure.
Okay. Many people are shifting to telecommunication to do projects and impact, I'm reading a question, on a provider's analysis of releasing an employee to return to work or offering restrictions. I'm trying to understand the question here. With many people shifting to telecommuting, do you project an impact? That's what the question is. Do you project an impact on providers' analysis of releasing an employee to return to duty and offering restrictions?
Yes, we do lots and lots of telemedicine visits for workers' comp at home and at the office. So we can actually see and examine the individual and actually return them to work. We actually do a lot of evaluations too for COVID-19. If somebody's home, they're not running fever, but they feel sick, you isolate for a couple of days, and if they don't have the fever, it's just itchy, sneezy, or kind of more pressured in the sinuses, like a sinus infection, then we can clear them from return to work, both in a workers' comp injury and also an illness standpoint.
I think the question, though, is, do you see, if they're working from home, what will that impact their return to work? Like, as a medical provider making that decision, can they return to work? Can they not? Will it be easier for them to say, yeah, you can continue to work, since they're already working from home?
Like if you're at home, I guess if you're home with no exposure, then hey, is that the question? You're at home, no exposure with anybody, yeah. Can you get back to work? Yes, that's actually, being at home, the key now is to stay away from keeping the sick people home and keeping well people away from the sick people, which would be home as well, are key. And then hopefully with all this isolation, no restaurants, the virus will start burning itself out. I mean, basically the sick people will get well, or they end up in the hospital and get well. And then the kind of virus just kind of goes away, essentially, if you isolate, because if the virus can't jump to another person, it essentially ends within about 14 to 16 days.
Yeah, I think the question, but I think it's still been answered, but the question is really more like, let's say they have a sprained ankle or an arm injury or something like that. Not so much the COVID-19, but will it impact return to work for people with other types of injuries?
Well, no, because we do lots, meaning if they're at home, will it lengthen the injury? No, we actually do lots of workers' comp injuries from home, and actually the return to work is much faster. You know, if you actually go to the brick and mortar clinics, it usually takes longer to heal than a telemedicine visit.
Okay, here's a comment and then a question. The comment is that using telemedicine, the doctors will follow any return to work report form, whether that be outlined from a non-subscriber or a DWIC 73 from a workers' comp covered. So a provider that's doing telemedicine will do those services. How quickly would ReadyMD provide those reports back to the case manager or claims adjuster?
Great question. Whether it's a DWC 73, DWC 69 for subscribers, or you have your own form for non-subscribers, those forms will be returned to you within 1 hour or sooner. That's kind of our brick wall. They have to be with you guys an hour for all our staff.
Okay, and I just want to make a comment that there are several providers out there that are doing telemedicine. Some of them require that you have equipment, and which is why, you know, it's important to kind of look at maybe the IMO provider search. There are telemedicine doctors listed there. ReadyMD does have a very efficient login process, as do some other providers out there. So I just want to make it really clear that if they're treating, because this is the question, if I have a case that's treating with a provider that doesn't really allow telemedicine, but we'd like to change the employee to a different treating doctor, telemedicine doctor, how easy or what's the process in doing that? You know, that depends, again, if it's a network claim, we would have to approve it with the network and the injured employee wanting to make the change, which a lot of them are asking and wanting to change treating because they want to do telemedicine. So that's something to kind of filter through your screening of the doctors. There are primary care clinics out there that want to do telemedicine. If you have doctors that want to do it and don't have the ability to do it, send those names over to IMO and we'll coordinate that with ReadyMD so they can work with them on the software or sign them up to be part of their coalition of their telemedicine group.
So the next question coming up is, for those employees working remote, Dr. Halston, how long do you recommend for them to work from home with this remote working? Is it a week? Is it 2 weeks? I believe actually the president spoke to this, but if you want to make some recommendations on that, that would be fine. But it says, for those working remote, how long do you recommend work from home? This week, next week, more? What's the expectation here?
Great question. If they can be efficient from working from home, I would say at least 2 weeks. And then let's evaluate in 2 weeks. If the if the cases are coming down, great. If the cases are still expanding, then I would keep them at home if they're efficient at home, till we see that the virus starts versus it expanding.
And just a comment too, telemedicine is for all types of claims in relation to carriers that are not in a network environment, okay? Carriers that are in a network environment or non-subscribers. So I just want to make that clear that it's available to all type of claims.
If I could just answer that other question. Another question was a great one. How easy is it to transfer over to telemedicine? It is very, very easy. We actually do lots of telemedicine patients that don't even have computers, have no computer skills. So to transfer over, they essentially call our customer service, who immediately schedules them in our system. our doctor will call that individual and send them a link to their iPhone. The only computer ability they need is to be able to answer a text message. And, you know, pretty much everyone could do that. So it's a very simple, very fast process. The registration process for ReadyMD is under 2 minutes. And generally, our customer service does that for them. So they don't really have to do anything but answer a text message.
And of course, our clients all know that if you need assistance with any of this, just reach out to us here at IMO. We have another question. It's, can you have the flu or strep and COVID-19? Can you have them all at the same time?
Yes, yes, you definitely can. It would be rare. You know, there's one of the things in medicine, they say when you see hoof prints, think of horses, not zebras, if you're in Texas. Now, in Africa, it's different. So generally, if somebody has an infection, it's probably one thing, but you definitely can have other infections, all three of those at the same time. It would be rare, but it is possible.
And can you be reinfected once you've been exposed?
Great, that's an excellent question. This is an RNA virus, so it is mutating, and there are some cases where somebody does get, especially in China. This is new in the U.S., but in China, they've been treated longer. There have been individuals that have been reinfected, yes. Now, I think that's rare, but there have been cases, yes.
Okay, well, those are the questions I have so far. And again, you can text questions if you like to 972-342-2141, or you can put them on the right side of the screen. And Catherine has a comment to make.
So, Dr. Halston, why don't you walk through just briefly the workflow process of just what happens when someone does want to go into the telemedicine model? What do they do? What's to be expected? You know, IMO did do a video with you, and it should be here shortly. But once that does come out, we'll put it on our website and let people review the actual live demonstration of a telemedicine model. But can you just go through just briefly the process?
Yes, of course. Thank you. And we've actually been doing this for almost, well, I've been in 20 years. So we have found early on it has to be simple or patients are not going to use it. So it's a very simple process. We have a 188-ReadyMD5 number they call that immediately, it's answered 24/7 by a doctor or customer service. We actually talk to the injured individual. And we ask, you know, all people can call because we do triage. Let's say somebody has a more severe injury and they just, hey, do I need to go to the emergency room, or what do I need to call an ambulance? Do I need to call Lifeline? We help with those decisions as well. But you call the 88-ReadyMD5, our customer service or a doctor will answer immediately. They let us know what the injury, how they got hurt, where they got hurt, what company they work for. We also make sure that they've actually appropriately reported the injury to the company. Once that's been happening, we just get them registered. It takes about 2 to 3 minutes for our customer service to get the proper information. They're registered into our software. Then we ask the injured employee, we have a lot of teachers, they get hurt, they get bit in the classroom, let's say, and they can't be seen right now because they have a class, but they can be seen within an hour. So we can schedule an appointment all the way from right that second to, 6 hours out if needed. So we schedule with one of our doctors on the appointment time. The doctor immediately calls the injured employee, takes a very thorough history to make sure the mechanism of the injury makes sense. And if there's any issues with the mechanism of the injury, I fell or something, make sure the mechanism of injury makes sense, documents that really, really well, and then actually we'll send either text message or email to the injured employee's cell phone, iPad, or computer. They link up live, face-to-face telemedicine. The physician will examine that individual, do a very good exam, thorough exam, making sure that the injury is appropriately documented, and also document there's no other injury. So in the future, if the patient had a back injury and now saying they have a shoulder injury months later, that can be documented that wasn't at the time of the injury. After that, the appropriate medications will be sent to the pharmacy, and the appropriate sheets will be filled out. The 7369s or the non-subscriber forms will be filled out, sent to the company. the adjusters, and we have a portal we upload all the forms to within the hour, where in the future, if you ever need to get any forms, so we'll be on your portal, and we're available 24/7. So if it's 4 o'clock in the morning or 2 o'clock in the afternoon, injured individuals are always seen very, very appropriately, and we're available for questions 24/7. And
Thank you.
I'm sorry, go ahead.
I always forget to say this, you actually get to see the same doctor every time. Very, very good continuity of care. Every study has shown when you see the same doctor and the doctor is well trained in workers' comp, patients return to work is much faster. And our visits through telemedicine, you know, our typical back injuries are 3 visits for simple back strains, no physical therapy. We're extremely cost effective, and our satisfaction rate with injured employees are extremely high because we see them around their schedule and they're confident they're getting very good care.
Dr. Halston, here's 2 questions. The first one is, my personal family practice provider asked if I knew of anyone that they can contact to help set them up with Telemed. Does ReadyMD clinics have services to help with that?
Yes, Cameron Smith is one of our customer service provider who helps doctors register into our system, and they can actually, the doctors can see their own patients through the ReadyMD software. Yes, we do.
Okay, so another question is,
Wait,
go ahead.
How do they access Cameron if they want to do that? Through IMO or through?
Cameron, we'll send the information for ReadyMD.
Okay.
Yeah, they probably just contact us directly. Yes.
Yes, directly. What is the cost? Is the cost comparable? What are you charging for your services? Is it comparable to the clinic, or how does that work in terms of the cost?
Oh, for workers' comp, it's generally it's less expensive than the clinic, and I think we're working that with IMO on a discounted rate for the injured employees.
Okay, very good.
Dr. Holmstein, up on the screen, we do have the evaluation form. I thought it might be of interest. First of all, I'll let everyone on the call know that we will send this to all of you. And you can also download the other handout, which is right within this webinar. That's the Q&A, most frequently asked questions. But for now, until I send this out, you might want to, we can scroll down, but you might want to walk them through this actual evaluation form.
Yes, this is, and the guidelines change, and I'm not sure, do I have the ability to scroll on this, or I guess you can just scroll down. Okay, yeah, this evaluation form, this is made for the company and the physician at the same time. You know, just some demographic information, questions, flu vaccine. You know, big question, why do you do a flu vaccine? Because if they've been vaccinated against the flu, it's less likely to be flu, more likely COVID-19. Travel out to the United States is important questions. And these are questions that you can ask your injured employees, your employees that give you an idea if it's more like COVID-19. And these are other things, you know, past medical history is very important, above 55, diabetes, hypertension, developmental delays, chronic lung disease. You know, if you do have high fevers and these chronic diseases, then it's more likely that we need to watch you closer. More likely, we don't want to send people to the emergency room or to, you know, to the ER unless they're having some of these more, you know, chronic disease plus with COVID-19. And it's also with testing, when they have chronic diseases, it's more likely that they need to be tested. So these are some good questions you can ask, you know, your employees at home. That would be more likely, hey, this is stay home, don't, you know, worry, but don't go to the hospital, versus you need to go to the hospital. These are other symptoms, you know, headaches, muscle cramps, cough, fever, vomiting, diarrhea. These are the symptoms of COVID-19. There are a lot of other illnesses that can cause this. That's why you really need to be evaluated by a physician. Just a form can't do that. Here's the coronavirus evaluation form instructions. These are protocols you can use. What's the next step when somebody has fever, what to do. You need to isolate them. If they do come to the office with this, you need to isolate them from everyone else, put them in a room, isolate everyone else around, and then actually send them home and properly clean up the area with the disinfectants we talked about. Here's some testing criteria. Right now, if you're at home, even if you do have COVID-19 and you have mild symptoms, you do not need to get tested. You do not need to go to your primary care doctor or hospital, but you do need to get tested. These criteria are probably 4 or 5 days old. They may change, but this is the latest when to determine if you need to get tested or not right there on the testing criteria. And then lower is just kind of a protocol. You can skip it down a little bit. Hello? Oh, there you go. And then this is just kind of a triage you can use as well and that's our website to use ReadyMD. And IMO has set up a special code for ReadyMD that you can log into, and it goes straight to one of our doctors that's going to be one of the experts or know a lot about COVID-19 and how to treat it.
So has any of this generated additional questions from anyone? If so, go ahead and text or put it in the question area of the webinar, and we'll make sure that we get answers for you. I'll give a few minutes for people to type in some potential questions that they might have. And I'm going to switch back over to our PowerPoint. Again, while you're thinking about questions, remember that after the call, you can email questions to the IMO Telemed at injurymanagement.com. You can use my number, that's fine. I'll get the questions to the right people. Again, we're going to send out this form we reviewed, and we're going to also send out the Q&A just in case you are not familiar with downloading it to all of those who participated in the call.
Dr. Halston, this is DC Campbell with a quick question. This is probably a worst case scenario, and I'm sure some of it you might have already answered, but in combination, assuming that someone gets injured, and while they're going through that interview on the telephone or on the iPhone or laptop, they also exhibit strong symptoms of the coronavirus. So they have, say, a low back soft tissue injury, but also exhibiting coronavirus symptoms. What special arrangements do you think would come out of a situation where you have both an injury and the coronavirus symptoms at the same time?
Great question. That's an excellent question. So we can still treat the injured employee. We wouldn't want to use, may or may not use steroids, but we can use medications that would probably help with COVID-19, the symptoms, ibuprofen, Flexeril to help with the muscle aches and pains. We'd also the good thing then is we're seeing the injured employee, if they're running high fevers, we can ask about their chronic disease management. Nice thing about ReadyMD, we do workers' comp and primary care and chronic disease management all at the same time. So we can actually treat that whole individual at home. We can actually treat their diabetes and hypertension. We can help with the COVID-19, and we can do the workers' comp all at the same time. So if let's say they are running high fevers, they are, let's say, asthmatic or have COPD, we'll then monitor them. If they're having severe symptoms, then what we do is we'd send them to probably severe symptoms to the emergency room. We would let the emergency room know that they're coming with COVID-19 so they can be prepared to actually, put a mask on the individual as soon as they get there and isolate the individual. Did I hopefully answer it all?
It appears that Gordon has a question. If you still have a question, Gordon, go ahead and ask it. Okay, I'm going to assume that you don't want to ask a question. Okay, or maybe it was answered. Checking for other questions, just a few minutes here, people, and I will.
Okay, wow. DC, if you'd like to go ahead and wrap it up here, I just want to make some comments that IMO is ready to work with anyone out there that might need us to do something just a little bit unusual. Maybe it's some telephonic early intervention of communication. I think one of the things we did toss around was that when we're managing a case, whether it be field, non-network, telephonic, or in-network, that the case managers wanted to start screening and asking the employee questions to help filter any kind of screening to kind of see if there's any exposure out there. If you are interested and you're listening to this and you'd like IMO to work with you and kind of do some things a little bit different, please reach out to either Donna Ramsey or myself to facilitate a conference call to discuss that. With that said, I'll let DC give us the ending of this. We thank you so much, all of you, for attending and all of the wonderful questions we received. Thank you so much, Dr. Halston, for partnering with IMO as our Telemed advisor and for the great work that you do. Thank you so much. DC?
Thank you.
Thanks, Catherine. Yes, I want to reiterate what you said. I think we're very fortunate to have Dr. Halston as our partner. We appreciate your professional expertise and advice. We look forward to continuing to work with you, particularly during this time. And with all of the information, the education, the practical advice that you've given us, we appreciate it. To those listening, I hope this was helpful to yourselves. Hopefully there's some things that you can take back home to your families as well. Keep in mind that IMO is here for your injured employees. We'll be available. We're still here, 100% covered. And with ReadyMD 24/7 coverage, we're continuing to be available for your injured employees as well. So we want to thank you for listening in. Again, if you have additional questions this afternoon or tomorrow, something might pop in your mind that you want an answer to, you can use our email address, IMO-Telemed, TELEMED, @injurymanagement.com, which is on the screen, or you may also text 972-342-2141. We thank you again. We hope you all take good care of yourselves, and we hope to talk to you again in the near future. If this becomes an important tool for us to get information out as things change, we'll certainly let you know. And again, thanks again to Dr. Halston. Thanks to you for attending. Thanks for your questions. And hope you all have a great week, and hope things turn around for us all. Thanks again. Bye.
Thank you. Bye-bye.
And just as we close, I want to let you know that IMO has recorded this. If you should need it for anyone to listen to, please just contact us. Thank you so much and have a great day. Be safe. Bye-bye.